We are in one of the worst staffing crises that we've been in.
A report by the World Health Organization found an estimated global shortage of 13 million nurses. The Middle East accounts for around 17% of that number. And as the nursing shortage reaches the US, virtual reality startups in Israel are rapidly developing products that may help.
We are focused on VR because we think that simulation-based training using VR to replicate real-world situations where healthcare practitioners can practice without jeopardizing patients. There's a massive use case just for VR.
Inception XR is a Tel Aviv-based startup that's working on simulations that train nurses to avoid spreading infection. Normally in the US, this training can be time-consuming when done in the real world, but simulating the training virtually could train many more nurses in a much shorter period of time. When a nurse enters the simulation, they see a room that looks similar to one they would normally work in. They're given one of many tasks, such as inserting an IV, or even changing a soiled bed pad. The simulation tracks areas the nurse contaminates without disinfecting. The speed at which the simulation shows spots the nurse missed can't be replicated in the real world.
Nurses work very hard. They have very limited time for any activities, and they probably make many mistakes during this time. And our bringing them into a simulation that makes them think about infection will just make them think about it when they go to the room and to treat patients.
Another Tel Aviv startup called GateBetter brings virtual reality to the world of physical therapy, only this time without a headset. The simulation is displayed on a screen attached to a treadmill. When older adults are hooked up, their precise feet movements are tracked, which allows them to simulate walking in what feels like a real environment. The company says this added cognitive element reduces falls by 50%. They're aiming their product at the US market right now. But because of the trouble the American healthcare system is facing, it hasn't been easy.
Unfortunately, the U.S. healthcare system is not set up or suitable for preventative care, and GateBetter is all about preventing fall, right? That's where we see the biggest impact. And that's why we're also looking for other territories that are more suitable for that.
Preventive care in the US does fall behind much of the world. A study by the Commonwealth Fund found US healthcare ranked last compared to 10 other major nations studied, such as the UK, Australia, France, and Germany. But ultimately, the size of the US healthcare market is difficult to resist for Israeli startups.
We naturally trying to aim for the US market because the Israeli market is just too small for business to raise money or to be attractive enough.
The developers at the Israeli startups feel optimistic as big players like Meta and Apple enter the virtual reality market.
And obviously the Apple headset's going to be a game changer, as well as obviously people like Facebook, where Zuckerberg has made a massive commitment to this medium.
Back in the US, educators are cautiously optimistic these new technologies will be a net benefit to upcoming nurses and the broader healthcare system.
And one of the things that is important to recognize, though, is that using technology just for the sake of technology is not always effective. But when you have the right technology and the right feedback and the right amount of practice, then you can really achieve great things using technology.
From Tel Aviv, I'm Patrick Doyle, reporting for the Media Line.